When your child has an abscess or swelling, it can be very, very concerning. Abscesses occur when there is an infection in the tooth. Sometimes, because of the hidden nature of these cavities in between the teeth, you might not even be aware that your child has a cavity. If that is the case, please do not panic. Your dentist will know how to deal with it and how to reassure your child as well. Initially, abscesses can be painful if they are pushing up against the gum and the bone, because that building up of pressure from the pus is what causes the pain. Sometimes the abscess will deflate or go down or stop being painful, and that is because the pressure aspect of the abscess has gone. That does not mean the infection has gone. Unfortunately, unlike other parts of our body, giving an antibiotic does not take away the source of infection as it would do with your tonsils, for example, or any other part of your body that was infected. When it comes to a tooth, the only way to stop the infection is to either do a root canal treatment for that tooth to remove all the bacteria and debris from the root of the tooth, or to extract that tooth and take it out of the mouth. Your dentist will discuss with you what options are viable for your child, and it obviously depends on the child and the tooth and how long they are going to retain that tooth. All the treatment options will be discussed with you, and you can make a decision in an informed way. Sometimes, if the swelling is severe, we might prescribe some antibiotics to begin with to allow the swelling to come down before we do any dental treatment. You can imagine that if something is painful and sore, you will not want anybody to poke around and touch it. Sometimes, in rare cases, the type of antibiotic might not suit the type of infection, especially if your child has had multiple infections in the mouth. We might need to prescribe a second type of antibiotic to address this issue. If the swelling or abscess becomes so severe that it affects your child's breathing, this is when you need to seek care from A&E and take your child to the hospital to make sure that their airway does not become compromised. Swellings under the eye are also dangerous, so please make sure that if the swelling spreads to beneath the eye, you take your child to the hospital immediately.